My name is John Hixson. I'm from San Francisco, California. In the next half hour, we'll be talking about digital life in the hospital, and that's such a huge topic. I'm not really sure where to start, but I just have a few slides. I work across multiple care settings and multiple hospitals. So one is at the University of California, San Francisco, which has both an adult hospital and now a brand new children's hospital. And I'll show a couple of slides relevant to the digital innovations that are happening at the current children's hospital. I also work at the San Francisco VA Medical Center, which, as many of you know, the Veterans Health Administration is the largest integrated healthcare system in the United States, and there has been a very strong push over the past 10 years, really, to integrate digital health solutions into that setting. So this is a slide demonstrating the iPad. And this really is meant to address some of the issues in the VA system. So the VA system has been very proactive in building an app store. And actually, if you go and do any basic Google search for the Veterans Health Administration and mobile health, you'll find that there's a very proliferative app store now, both for caregivers, patients, as well as clinicians. And we've been very involved in getting this up and running in the VA system. In fact, here is the VA App Store, which is accessible. Many of these apps have been developed within the past 5 years. As I mentioned, there are really two stores, one for patients and caregivers, and then another primarily for providers. And at our particular VA in San Francisco, we've now been piloting the provider applications for the past 2 years. This is a screenshot from our new children's hospital. I am actually not the physician who works at the children's hospital, but I have many close colleagues who do. I asked them what a couple of the most prominent innovations in digital health were, and one of the informaticists at the hospital told me that the biggest innovation was the availability, as you can see in this screen, of these large screen plasma TVs, which directly connect to the medical record, and perhaps most importantly, directly connect to imaging. So as you can see here, the patient and their family are able to review images and lab results directly in the room with the physician. And then I'll just end with saying that I asked my closest colleague, who is one of the directors of pediatric epilepsy at the new children's hospital, what his impression was of the greatest digital innovation at the new hospital, and he told me the green spaces. So I just think we should all remember that although digital health certainly has great potential, and we all are believers here by the fact that we're at this meeting, we should all remember that getting out in nature and being exposed to the wonderful outdoors is also a very therapeutic experience.
Thank you, John.